If you have tennis elbow, I'm sure you are acutely aware of the excruciating pain that you can sometimes feel on the outside of your elbow, even down into your forearm. So what is going on there? Why is it so painful? I've had patients and clients come to me saying, I know I need an x-ray. I think it's broken. People are feeling so much discomfort, so much pain that they think their bone is broken and they want to get an x-ray, some imaging to see if that's actually the case. And if they do have the x-ray, obviously the x-ray always comes back completely fine because it's not that the bone is broken, even though they're feeling this excruciating pain. Well, what is going on? Well, tennis elbow affects a tendon, and a tendon is a connective tissue. It connects the muscles of the forearm to that bone on the outside, that bony point on the outside of the elbow. That bony point is called the lateral epicondyle. And this tendon, it's only about 1 centimeter long. It's actually quite small, but a tendon is a connective tissue attaching the muscles to that part of the bone. What happens when you have tennis elbow is that that tendon starts to degenerate. Now, this is nothing to do with age. It's not, oh my goodness, I'm getting old and I'm falling apart. The tendon is degenerating because of overuse. Imagine a rope. That's what a tendon kind of should look like on imaging. So if we did an ultrasound scan or we did an MRI scan, a tendon should kind of look a bit like a rope. So all the fibers tightly packed together, very uniform, all going in the same direction. Now imagine if somebody got hold of a rope and they twisted it the wrong way. So they were kind of unraveling it. That's what a tendon that has tennis elbow looks like on imaging. On an ultrasound scan or an MRI, you see the fibers are not uniform anymore. They're not tightly packed together anymore. It's like they're splaying apart. They're becoming apart. Cells get in there that shouldn't be there, and that causes irritation. And it causes a weakening to the tendon as well. A lot of people think that inflammation is what's causing the pain in tennis elbow, and that is the case in about the first 3 weeks of pain. But once you get beyond that, and most people who I speak to are way beyond that point, the amount of inflammatory cells, the inflammation that's there, really diminishes pretty quickly. But why are they still feeling pain then? Surely it's inflammation that they're feeling. It's not inflammation, it's irritation, and it's this degeneration of the tendon. Now, there are certain things, some treatments that can work on purely pain relief. So if we think of painkillers, for example, you can take a Tylenol, some kind of pain-killing medication that blocks the pain messages getting through. And you might feel better for a short time. It's done absolutely nothing to heal the tendon. All it's done is blocked the pain messages. And treatments fall into 2 categories. Pain relief, which obviously is important. We want you to feel better, but then also true healing. And if you want to feel better long-term so that this doesn't keep coming back, so that you can get back doing everything you want to do, you have to work on healing the tendon. Pain relief is not going to be enough for it to feel better and stay better long-term because the tendon truly hasn't healed. So it's really important to understand the distinction between those 2 things. And many of the common treatments for tennis elbow, whether that is ultrasound treatment, whether that is pain medications, whether it's a cortisone shot, whether it is massage around the muscles, all of these things work for pain relief. They don't heal the tendon. And so this is why it's quite common to hear people say, oh, I had an injection or I had a treatment, whatever it was, and it got better, but then it came back. Well, the tendon never actually truly healed. And that's the portion that needs addressing to allow the tendon to heal so that you then also get pain relief. So we're getting both things, but it's not going to keep coming back. It's not going to be this cycle of pain and then it feels better and then pain again and then it feels better again and then it feels really, really bad next time it comes back. We don't want that cycle, because what that does, it then heads towards a hypersensitivity of the nervous system, which can just put you into this cycle of chronic pain, so that the slightest little thing is going to trigger it. And it might even then start to affect other tendons in the body as well. The longer this goes on, the more that potentially could happen. So sometimes people will say, well, it started in my tennis elbow, and then I started to feel it in my golfer's elbow, and then I got it on the other side, and then it started affecting this thumb, and then this shoulder, then this knee, then this Achilles, and it just spreads from there. So the best way to treat tennis elbow is to heal the tendon. There's only one thing that will actually do that. The research shows us that, and it's eccentric exercises, eccentric loading. So if eccentric exercises and eccentric loading is not a part of your rehab program, you might get some pain relief, but you're not healing the tendon. And if you don't truly heal the tendon, then it is going to keep coming back. Now, having said all that, it is really important to get some nice pain relief. And so I would love to invite you to download my new pain relief planner. It's your 7-day jumpstart to healing. You can find it in the link around this video. It's completely free to download, and it takes you through step by step what to do over the next 7 days to get yourself the best pain relief in the shortest amount of time, and really help to kickstart the healing process and set yourself up for success as you move forwards, so that you can be comfortable whilst you're healing the tendon. So please download that and let's work through this together. If you have any questions, please don't hesitate to reach out. I love questions, and let's get you some really nice pain relief, and let's get you on the right track to actually healing your tendon. Hope that helps. Hope to see you with your planner soon, and check out my next video. Take care. Bye.